As you probably know from the material, joining is really the first stage of implementing family psychoeducation. In technical terms, it's much like engaging or developing a therapeutic alliance in other therapies. What's different is that it's a real partnership development process in which you want to build rapport, particularly to convey to relatives and the consumer, him or herself, empathy, hope, and particularly establishing a kind of collaborative alliance. That's what distinguishes perhaps family psychoeducation from other therapies. It's really a working relationship in which the object of treatment is not any person, but the illness itself. Often, joining occurs soon after a crisis, for instance, a hospitalization, or when a probable diagnosis is made. But really, joining can occur at any time that a consumer or family could benefit from this approach, request certain aspects of the treatment, or makes themselves available. Other common reasons that people engage into the practice, including ongoing family conflict, consumers particularly being stalled in a particular stage of recovery, and families desiring more involvement in the treatment. I think the other time that you'd really want to look at the possibility of family psychoeducation is when people are having repeated hospitalizations in spite of medication compliance. So, what is joining? First of all, gathering information is part of the joining process. As you probably have seen from the material, there's a specific structure that we recommend for each of the sessions. That involves socializing, then doing the work that's part of the protocol or the approach, and then socializing again. Just some practicalities: 3 or more joining sessions are usually held. It usually takes at least 3 to get through all the aspects that are found to be important. Depending on clinical indications, family and consumer meet together for most sessions, although it's usually important to have one separate joining session so that each member of the consumer or family group can have the opportunity to share with the clinician what they feel and what they've experienced without feeling intimidated or feeling the need to censor or protect the other party. The first joining sessions, like all subsequent sessions, starts with a period of socialization. Because the practice of family psychoeducation can be a long one, it's important for the practitioner to build a relationship such that the family and the consumer have a perspective that this is going to go on beyond the illness. As the business section of the joining begins, you usually review any recent or current crises, if not more general exploration of characteristics of past crises have occurred, and then you start paying attention to the specific aspects of the approach, that is, identifying early warning signs and triggers to recognize the ways that the families and supporters have coped during previous episodes. Right through this whole joining process, it's extremely important to validate the family's experience as a normal human response to an abnormal and distressing and sometimes almost tragic situation. By the end of the first session, the practitioner should have established that he or she will treat all family members with respect and act as an advocate for the patient. And by the end of the joining session, both the family members and the clinician should have a sense that they have an alliance and a collaborative working relationship that will support the rest of the work as they go forward.
Well, how have the Red Sox been doing? Because I've been out of it. I haven't been watching at all.
Well, this is interleague play.
Yeah.
And they went to St. Louis and lost 2 out of 3.
Yeah.
And I was getting a little discouraged.
Were you watching the whole game, or were you turning it off?
I kept turning it off.
Did you?
I was getting discouraged.
I'm really pleased that you brought your mom in. So I'm Liz McCauley. I'm Deb's therapist.
Well, it's nice to meet you, Liz. I am Deb's mom, Teresa, and I'm so glad that Deb invited me to come in today.
So am
I.
I.
Get a chance to meet you.
So how have things been going?
Recently, or
Yeah.
they've been pretty good recently.
How's it bringing your mom in here?
Scary.
Is it scary? It's a little bit unusual. How do you feel about coming in?
Well, I was a little nervous, I have to admit. I wasn't quite sure what we were going to do today, but it made me feel good that my daughter wanted to bring me in. So,
Well-
yeah, I'm just not sure what to expect today.
Well, we'll play it by ear, and it's great to have you both here. And I don't know if you're as big of a Red Sox fan as Deb is, but I don't know if I'm keeping you guys away from a game. I know it's probably starting soon.
I don't think anybody's as big a Red Sox fan as my daughter is, so. But I like them.
Good.
Yeah.
Right. Well, you know, over the past couple of weeks, Deb and I have been meeting and talking a little bit about different programs that we have here. And really, Deb and I talked about having you come in and being kind of another support person that's working with us. So, you know, Deb, maybe we could talk a little bit about what's been going on, how you've been doing, and how your mom can be involved in this.
I was in the hospital, and when I was in the hospital, I started having anxiety attacks, and I never had those before. So that was
something new.
right.
Were you aware of those?
I was.
Yeah.
I was when I went to the hospital to see her, and it was really hard. It was hard to see what she was going through. That whole hospitalization was a difficult time for all of us.
So, I wonder if we can start by talking a little bit about what the process of that was and how that started, what it was like. And I know that, Deb, you're pretty aware of some of the warning signs. I don't know, I haven't talked with your mom about how much she knows what the warning signs are. You and I have been talking about them. But maybe we can start by talking about that.
Well, to start off with, I had just gone to see the Red Sox World Series trophy up in Essex.
Yeah.
So that was a big factor.
That was a big thing. I remember those pictures still from that.
And some of the warning signs are that I don't sleep well. I start making lists, my teeth chatter, give me messages.
And those are warning signs that you know of.
Yes.
And we actually, I don't know how much you guys talked about that, but that's something that before that hospitalization, you came in here and we talked about those things. All right, this is what's starting. Have you guys talked about that together?
We have somewhat, mainly it's just I notice these things, you know, we talk almost every day on the phone, and so I've gotten used to, okay, when she brings up these things, these are kind of a sign of what's going on with her. And that's probably about all I know. I don't know what it's like for other people, I just know what it's like for my daughter. But yeah, some of the things she says, like making the lists and, you know, all those kinds of things, I do
You start to
recognize
notice
those.
that.
And then I do bring it up to her.
You mentioned that you guys talk pretty regularly on the phone.
We do.
Is that a good support for you, Deb?
Yes.
Having your mom around?
Yes.
Yeah. Do you feel like she kind of knows the warning signs too?
Yes, I do.
And does she give you feedback about them, or do you guys not really talk about it?
We don't really talk about it.
No.
The second session, as almost all the sessions throughout family psychoeducation, begins with socializing, simply bringing yourself and the family up to date about what's been going on in their life. That includes a consumer, obviously, if they're present for these sessions. But also, this is the beginning of the process of letting the family know that they're going to hear a little bit about what you've been doing, too, so that you're on an equal footing. The session then usually turns its focus to the impact of the illness on the families and other support persons, as well as the consumer. In some cases, this session may best be done in separate sessions, that is, consumer and family members apart, especially if the consumer is not yet to the point that they accept that he or she has an illness or a problem. Separate sessions may also be indicated if the family member or consumer may be treated in terms that are too harshly impacting on the other. However, some benefit, and sometimes considerable benefit, can be accrued if the consumer can participate in some aspects of this discussion with family members. In any case, at times a family member may require 2 joining sessions to verbalize feelings of loss, despair, grief, and frustration about the coping demands of the illness. The practitioner offers support, validation, recognition of the normal kinds of human reactions that people have to this illness, but they also want to avoid having the family become lost in their past despair and frustration. It's a balance between acknowledging and empathizing with the family's members' experience and also maintaining hope and a perspective on the future that says that this can get better, that in fact that it will get better. It's during this session that the practitioner usually would learn about the family's sources of support, that sociogram I mentioned, and other resources that they use to cope with the effects of the illness. Again, you'd close out the session with some socializing, thinking ahead to what the family might be doing for the next week or 2 weeks until you meet with them, and kind of sharing in what your own life holds, as long as it's reasonably normal and everyday. So that's the second session.
In this meeting, we get to explore a little bit about how you guys feel about the illness, how it's impacted your family, your relationship, and just have a chance to kind of talk about that a little bit. So Deb, I wonder if we start with you, and I'm curious about your feelings about it. You've had this diagnosis. How does it feel to you? How does it impact your life?
Well, at first, many years ago, it was very scary because even the doctors didn't know what to diagnose me with, and it seems like I get one diagnosis and then it gets changed, medicine gets changed.
Over the years.
Yeah.
And that is a very valid concern, and I hear that from a lot of people. That can be very frustrating, to be wondering what's going on, get one diagnosis, then get another one, have one med, then another med. That can be very frustrating. How have you coped with that?
Right now I have a doctor who I've had for many years. And one good thing is I know when I go to his hospital that he's going to be my doctor instead of having a different doctor each time. This past hospitalization, I was at a different hospital. The only positive I can see about it is they did I forgot the word.
Was it electrocardiogram?
An EKG on me, and they found out that the medicine Geodon that I was on was in the danger zone of affecting my heart. And for the number of times that I've been at the other hospital, I don't ever remember them doing an EKG on me, but they could have.
So one of the ways you've found to cope with getting different diagnoses and having different opinions about your diagnosis or which meds you're taking is to find a doctor at the hospital that you go to who can be consistent with your care.
That's correct.
Yeah. How about for you, Teresa? How has this experience been for you? And Deb's talking about getting different diagnoses over the years, and I'm sure you were there for a lot of that.
Yeah, my husband and I just, from the beginning didn't know what was going on. And like my daughter said, it was so frustrating. We'd get one diagnosis, then another. And to tell you the truth, I really didn't know a lot about the things they were talking about. So I'm relieved, too, that she has one doctor now. We have a diagnosis, and we're just doing the best that we can. And now, there's this latest thing with this medication and the EKG, but it's been kind of a hard time because I don't talk to a lot of other people about this except Deb and her sister. Her sister's a nurse, so we talk a little bit, but it's not something I talk to my friends about very much, and so I don't hear very much about it.
In terms of the third session, you've of course, would pay attention to things that still are undone. That is, any of the key clinical information that you haven't gathered at that point. But usually you'd be paying a lot of attention at this point to areas of personal strengths for the consumer and family. In other words, what are the kinds of things that the family members do to maintain their own mental health, their own stability, and to keep focus on things other than the illness and the consumer, him or herself. So, for instance, work, hobbies, school, other community and personal connection are identified as areas of support. In this last joining session, a discussion usually has to occur about the goals of treatment. In other words, you want to find out what the family members hope to get out of this process, and also particularly what the consumer would like to see happen as a result of this process for themselves in their own terms.
And what I wanted to do this week was spend a little bit of time talking about how things are going now and where we're going to go from here. The past 2 sessions that we've met, we've really talked a lot about the past and specific episodes where the illness got a little bit worse and had some symptoms. So today I thought we could talk a little bit about how things are going now, day to day, and sort of where we're going from here. So in terms of your day-to-day routine, I'm curious about how both of you see that.
Well, I'm doing a little bit better than I was because I'm cleaning house for an elderly lady a couple hours a morning and getting paid for it. And then I'm watching my grandchildren 1 day a week and getting paid for that. So that's giving me extra income.
So that feels good to you?
Yes.
To have something that's bringing you in money and that's productive and...
Right.
Yeah, it's nice to see you busy and working. And, I'm pretty busy a lot of the time, so it's good to see Deb doing that and doing something she enjoys.
And how are you coping with it? How do you make that happen? Is it something that's difficult, or is it pretty easy for you right now?
Well, sometimes in the morning I have to pull myself out of bed.
Yeah.
And I think, this is extra money. You're going to the grocery store and paying for things with cash. You're not throwing them on the Walmart credit card and then getting the bill a month later.
So that feels good. That's a good feeling. So in terms of where you see things going over the next couple of weeks or couple of months, what would you like to see for yourself?
I'd like to see keep myself out of the hospital.
Do you have any idea of what's helpful in terms of doing that? How you're going to do that? Well, or how we can do that?
Well, talking to you, talking to my case manager, keeping my mom informed.
This is also the time to prepare the family to move into the next phase of family psychoeducation, and that is the educational workshop. Finally, it's wise to review the structure and goals for both the workshop and the regular multifamily group meetings that will follow. Some family members may have experienced multifamily groups in the past, may not have had such a great experience, and will need to have those issues addressed. Letting family members know that they will not be expected to contribute any more than they wish, and assuring them of confidentiality is often important at this stage.
It's been great to meet with both of you, and it's been really nice, Deb, after knowing you all this time, to finally get to meet your mom. So I think it'll be wonderful. We'll see how the group goes, see what you think, and we'll keep talking about it as it goes on. And you and I will keep talking as well about how you feel like things are going, and if you're comfortable with it.
Okay.